Welcome to Pharmacology Outline channel.
In this video we will discuss how every antidepressant works. Antidepressants treat depression by changing the balance of chemical messenger called neurotransmitters in the brain. The main neurotransmitters involved in mood are serotonin, norepinephrine, and dopamine. Different classes of antidepressants work by affecting these chemicals in different ways. Understanding these mechanisms helps explain why some drugs work better for certain symptoms, why they take weeks to work, and why they cause specific side effects. 1. SSRIs, selective serotonin reuptake inhibitors. Examples: Fluoxetine, Sertraline, citalopram, escitalopram, paroxetine. SSRIs increase serotonin levels in the brain by blocking the reuptake pump, Sert, that normally removes serotonin from the synapse. When reuptake is blocked, more serotonin stays available to improve mood, sleep, and anxiety. SSRIs are selective because they mainly affect serotonin and very little else, which makes them safer and better tolerated than older antidepressants. 2. SNRIs, serotonin, norepinephrine reuptake inhibitors. Examples: Venlafaxine, Venlafaxine, Duloxetine. SNRIs block both the serotonin, Sert, and norepinephrine, Net, reuptake pumps. This increases levels of both neurotransmitters. By raising norepinephrine, SNRIs can improve low energy, focus, and chronic pain conditions, effects that SSRIs don't always provide. They are often used for patients with depression plus fatigue, neuropathic pain, or fibromyalgia. 3. TCAs, tricyclic antidepressants. Examples: amitriptyline, imipramine, nortriptyline. TCAs also block Sert and Net, just like SNRIs, but they are less selective and also block muscarinic, histamine, and alpha-adrenergic receptors. This is why they cause many side effects such as dry mouth, constipation, blurred vision, sedation, and low blood pressure. Despite the side effects, TCAs are powerful and effective for severe depression, migraines, chronic pain, and insomnia.
4. MAO inhibitors. Monoamine oxidase inhibitors. Examples: phenelzyme, tranylcypromine, selegiline. Monoamine oxidase is an enzyme that breaks down serotonin, norepinephrine, and dopamine. MAO inhibitors block this enzyme, allowing these neurotransmitters to accumulate. They are extremely effective but require dietary restrictions, for example aged cheeses, fermented or cured meats, soy sauce and red wines, to avoid hypertensive crisis from tyramine, and have many interactions. Because of this, MAO inhibitors are usually reserved for resistant depression. 5. Atypical antidepressants. These don't fit into the classic categories because each has a unique mechanism. A. Bupropion. Bupropion blocks the reuptake of dopamine and norepinephrine. This boosts motivation, energy, and concentration without affecting serotonin. It does not cause sexual dysfunction and does not cause weight gain, making it a popular choice. B. Mirtazapine. Mirtazapine blocks alpha-2 receptors, increasing release of serotonin and norepinephrine, and strongly blocks H1 histamine receptors. This mechanism increases mood chemicals while also causing strong sedation and increased appetite. Commonly used for patients with depression plus insomnia or poor appetite. C. Trazodone. Trazodone serotonin modulator partially blocks some serotonin receptors, while weakly blocking reuptake. It causes strong sedation. Commonly used for insomnia rather than depression. D. Vortioxetine. Vortioxetine enhances serotonin in multiple ways, blocks reuptake, modulates several serotonin receptors, and increases glutamate transmission. Improves mood, cognition, and memory in depression. E. Vilazodone. Vilazodone SSRI plus partial 5-HT1A receptor agonist. Sometimes described as SSRI with built-in anxiolytic effect. Acts similarly to combining an SSRI with buspirone. Why antidepressants take weeks to work. Although neurotransmitter levels rise within hours, mood does not improve immediately. The brain needs weeks of adaptation, involving receptor changes, gene expression adjustments, neuroplasticity, and increased BDNF. This slow remodeling is why antidepressants typically take 2 to 4 weeks to show benefit.